But this is very special to me, as the recipient has not only been a personal mentor to me, but he's somebody that I consider family. It is both an honor and a privilege to introduce this year's recipient of the William B. Long Meritorious Achievement Award for Excellence in Chest Wall Injury Management, Dr. Larry Lottenberg. As I can personally attest, Dr. Lottenberg is a name synonymous with dedication, leadership, mentorship, and innovation in trauma care. With a career spanning decades, he has consistently demonstrated an unwavering commitment to improving the lives of patients through clinical excellence, teaching, and advocacy. His work in the management of complex chest wall injuries has not only advanced surgical techniques, but has also fostered multidisciplinary collaboration and education within the trauma community. Beyond the operating room, Dr. Lottenberg has been a mentor, an educator, and a tireless advocate for improvements in the care of chest wall injury patients and trauma system development at local, national, and international levels. In fact, Larry single-handedly created the Level 1 Trauma Center at the University of Florida, his alma mater, among many other trauma programs within the state of Florida. After completing my own training, he recruited me to become his partner at UF, where I personally witnessed his dedication to patient care and, more importantly, his mentorship and camaraderie, which I know many of you in this room can attest to. Although I was trained in SSRF as a resident, many of the techniques which I still use today were taught to me by Dr. Lottenberg. In fact, in 2016, he invited me to join him at a little meeting in Park City entitled the Rib Plating Colloquium, a meeting and a group which would later be known as the Chest Wall Injury Society, and he would become the first president of this great society. Throughout his career, Dr. Lottenberg has published 100 manuscripts, written multiple book chapters, and has been recognized internationally for his knowledge in the care of the injured chest, having given numerous invited lectures on the topic. He has trained multiple residents, fellows, and other surgeons in the principles of surgical stabilization of rib fractures, and has assisted in the development of programs of excellence in SSRF throughout the nation. His contributions reflect the very spirit of the William B. Long Award, honoring those who have made a lasting impact in the field of chest wall injury management. So without further ado, please join me in recognizing this year's recipient of the William B. Long Meritorious Achievement Award, my friend and colleague, Dr. Larry Lottenberg, for his exceptional service, leadership, and lifetime dedication to the advancement of trauma care.
Well, I hope I can talk to you for a few minutes after that. I think my head must be out to here. That was very nice, very nice. I am absolutely in awe standing here today. I thought what I would do is take you through a little tour of what I've learned about mentorship. I want to start by saying everybody in this audience is a mentor of mine as well as a mentee of mine. And we, as Dr. Sackman pointed out, we need to really look at where we are with mentorship, because I think that really tells us what we're going to do. So let me see if I can get this going here. So I have no disclosures. And what I want to talk to you about a little bit is what is surgical mentorship? And as we go through this, I want everybody to think how we can become good mentors. My mentorship journey started with family mentors. Then I had surgeon mentors. And of course, I have my CWIS mentors. So let me just take you through a couple of things. The tradition of mentorship in surgery dates back centuries, beginning with apprenticeship model and evolving into what we have today in our teaching. And we don't have to say it too many times, but Dr. Sackman's institution, where Dr. Halstead was, that was the beginning. But mentorship today is multidimensional. It includes the development of operative technique, clinical acumen, research skills, leadership, professionalism, and then finally wellness. There are many studies, and I'm not going to sit here and quote study after study, that have shown that strong mentorship gives you higher career satisfaction, academic success, increased publication output, and reduced burnout. And as you go through this, think about that. Mentorship also plays a critical role in our career choice. Trainees exposed to effective mentors are more likely to pursue academic careers and fellowships, underscoring the influence mentors have on surgical pathways. What are the characteristics of an effective mentor? They're accessible, they're patient most of the time. Most of you know that may not be me. They're constructive and supportive. They model excellence in and out of the operating room. They're candid, that's me, offering real-time feedback and creating space for critical self-reflection. In our environment, mentors should guide the technical development while emphasizing patient safety, communication, and ethical decision-making. The most powerful mentors are those who remain lifelong advocates for their mentees and writing letters of recommendation, facilitating job placement, and encouraging scholarly activity. And I think that there is everybody in this audience has been a part of this, and you pretty much know what I'm talking about. What is the crucial role? Well, skill development, professional growth, patient safety, psychological support, networking opportunities, and impact of mentorship. And when you see the next slides, you'll kind of realize how all this fits together. So I think to be a good mentor, number one, you got to be a good mentee. You got to learn from your mentors, but you got to be a good networker. And you got to get out there and you got to build things. And I'm looking out here, and it's just amazing what we as mentors have been able to build. So let me go through some challenges, though. Mentees and mentors, we all find this protected time, we need to do this. And this is what we face today. There's differences in communication style, learning preferences, and work-life balance. That's changed a lot. Women and underrepresented minorities in surgery often report difficulty finding mentors. And as we get to the end, you'll see what role the bias and inequity have played in my career, which has been very exciting for me. So let me start by talking about some family mentors. This was my dad, Louis Lottenberg. He was born in 1913 in Paterson, New Jersey. His parents owned a candy store. They were immigrants that came over to Ellis Island. He grew up in Brooklyn, New York. He went to college at NYU, and he graduated from the Philadelphia College of Osteopathy in 1942. He practiced medicine and surgery for 35 years. Why do I say that? Well, for those of you that don't know osteopathy, and I know it well because I grew up in an osteopathic environment, during World War II, just like we're seeing today in the military, with certain groups being prohibited and kicked out of the military, the United States military decided that DOs could not go overseas and administer our wounded warriors. So my dad had to stay home. So here he was out of medical school, and all of a sudden he was delivering babies, and he was doing appendectomies, and he was doing cholecystectomies. And he did this. He charged $3.50 for an office visit, $5 for a house call. All of this through those 35 years, he worked and worked and worked, and we watched him work. And myself and my two brothers, he put all three of us through college and med school with no debt. So he became a mentor for me. And I used to start my mentorship, my idea, is when I was 10 years old. And every Saturday morning, I got on the subway from where we lived in Queens, and we went to his office in Brooklyn, and I stood there in his office, and I was the guy that turned the fluoro machine on and off while he did upper GIs in his office. He had 3 grandchildren, 4 great-grandchildren, and he died quietly at the age of 94. And, you know, I just brought a couple of photos here. The one on the left was when he and my mom got married, and typical, he married his office nurse. You could see she was beautiful. The next picture over on the right could be me at a CWIS meeting talking to a bunch of people and networking. But that was my dad. Remember that bow tie. And then the one on the far right is my parents at their 50th wedding anniversary. Now, it's very hard to see on the bottom, but there's a textbook I keep on my desk. This is a book called Elements of Surgical Diagnosis. This is my dad's surgery text in medical school. It was copyrighted in 1939. I have the page open to fractured ribs. It is amazing how this read in 1939 and how it reads today. Absolutely amazing. So I have one more family mentor, and I'm sure this will get Dr. Saccharin going pretty good. This guy is former Senator Frank Lottenberg. He is my second cousin. Now, why do you think the spelling of his last name is different? His father and my grandfather arrived at Ellis Island at the same time. They got in two separate lines. And one guy at Ellis Island spelled the last name like that, and the other guy spelled it the way we spell it. Frank was also born in Paterson, New Jersey. He was a U.S. Senator from New Jersey from 1982 to 2013. He was a businessman. He started this ADP payroll processing in Secaucus. Anybody from New Jersey, if you've ever been to the Secaucus train station, you know it's named after Frank. But what does he have to do with surgery and trauma? Frank sponsored a domestic violence offender gun ban known as the Lottenberg Amendment in 1989, Joe. In 84, he wrote the National Minimum Drinking Age Act that federally changed the national drinking age to 21. And in 2000, he wrote the act that changed DUI to .08. And I used to visit him, see him in his office, great guy. He died at the age of 89 in 2013. So that's a great thing. Now, as we go on, what about surgeon mentors? So I want to take a few minutes and talk about this surgeon mentor. This is Robert Zeppa. He was my chairman when I was in medical school at the University of Miami. He was my chairman when I was a resident at the University of Miami at Jackson Memorial Hospital from 1975 to 1980. This guy made a big, big difference in my life as a surgeon. He always did the right thing. He was always concerned about conduct and reputation for the profession of surgery. He had his presidential address to the American Surgical, talked about that, always tried to train us right. And the one thing that Dr. Zeppa taught us all the time, look at that second little bullet. Every other day call is good for you because is not so good for you because you'll miss half the cases. So he was an operating surgeon, and he always taught everybody to do the right thing. And a couple of things about his academics, you can see here what he did and what he did for us. In 22 years as the chairman of surgery at the University of Miami, Dr. Zeppa trained 143 surgeons. Of those 143 surgeons, about 30 of them are practicing in Florida. And there are surgeons who are also chairmen and program directors and whatnot. Believe it or not, this is my graduating picture in 1980 when I finished. And there he is, wearing his bow tie. Remember the bow tie? My dad with the bow tie. I don't know why bow ties keep showing up in my life. One thing about trauma. The trauma service was established at Jackson Memorial Hospital in about 1970. I trained there from 75 to 80. In 1980, after riots and the Cuban boat lift and Miami Vice, the entire system fell apart. And there was no trauma centers all of a sudden except for JMH. And in 1986, Dr. Zeppa said, nobody wants to do it, I'll do it. He was a hepatobiliary surgeon, as some of you remember. He is the deviser of the Zeppa-Warren distal splenorenal shunt. He became a trauma surgeon in 1986 and undertook this. Here's a couple of quotes from some newspaper articles way back in the 80s. The Knife and Gun Club they call Saturday night at the Jackson Emergency Room. Something about the city, the night, celebrating booze and drugs that leads to arguments and violence. Throughout the night, victims arriving in ambulances. It's ugly, wretched work, and the staff in the emergency room has strong opinions about guns in American society. This was in the newspaper in 1987. And here's Dr. Zeppe's quote. It's going to get worse and worse and worse as we have more and more guns. The more guns you have, the more bullets, they hurt people. Amazing how this has come now full circle. So what did he do? He said, I'm going to run this place and I'm going to build the Ryder Trauma Center. And he built it. The Ryder Trauma Center was $2 million short to completion, and he went out and got a $2 million donation and finished this building, and it's still obviously still there today. Here he is on trauma call in 1992. This was about 6 months before he died suddenly while on call of a pulmonary embolus. And certainly we all miss him, but what he's instilled in us as a mentor is amazing. And, you know, I couldn't put everybody's name on the list. There are so many mentors in my career that have made a difference for me. And if you look here on the left list, these are the mentors in my training and in South Florida that I grew up in. On the right list, Chasen told you I got recruited to the University of Florida in 2003. There was no trauma center there. When I showed up, they all looked at me and said, what are you doing here? This is crazy. We can't do trauma, cancer surgery, and heart surgery in this institution. But Dr. Copeland had faith in me. I recruited Fred Moore. I recruited Chasen. All of these people made a difference in my career. Now, as we transition over to CWIS, let me tell you, I started at UF in 2003. In 2005, I was just getting the trauma center going, and the neurosurgeons came to me and said, we need an approach surgeon. We need somebody to help us get in the chest. We need somebody to help us get to the spine. I said, okay, I'll do it. So I started doing thoracotomies with the neurosurgeons to give them exposure for multiple thoracic vertebrae so they could get their plates, cages, and screws in. And the only way I could think of getting them great exposure was to cut 2 or 3 ribs above the inner space they wanted. So I would take a rib cutter and cut the ribs. So then I was kind of looking around and reading some stuff, and I came across this guy, Mayberry. And this guy, Mayberry, had come up with this kit called U-plates. And it was a little tiny plastic kit. And I brought this little kit in, and I started putting these ribs together that I had cut myself with these little U-plates. And that was the beginning. That was in 2005. And then I talked to John, and then I talked to Bill Long, and I talked to Trunky, and Bill Long goes, well, why don't you call the oromaxillofacial surgeons and get some of their recon plates and put those on. And for those of you that don't know, that's how Synthes started their rib plating. They were recon plates for the mandible. And so all of these people in my career made a real difference. They're all my mentors. Now, here we go. So here we are, and I brought this document up again. Tom and Sarah know this document. This document on the left was a meeting in 2013 in Las Vegas that the thought that Tom had, let's put some people together in a room in Las Vegas, okay? So look at this list of people here, okay? You see Jose Diaz, you see Tim Pullman, you see Tom, you see Kim on here, a lot of people on here. This was the first time that a group of people got together and thought about chest wall reconstruction. Andy Dobin's on here. And then the next thing that happened was the inception of CWIS. And here you see a couple of pictures. You see Mayberry, you see Bob, you see Fred, you see Ron. On the bottom, you see Bill Long, Andy, Tom, and Sarah. And that's almost 10 years ago. And when we first started this thing, and I always go back to this quote, I said, this is going to be great. We're going to have a great society. And I said, year one, I said, within 5 years, we'll have 500 people in this society. How many people we got now? 800 members. 800 members. And look what happened. All because we had an idea. And, you know, I still go by these are a couple of slides from lectures 10 years ago, talks 10 years ago. And look at the one on the bottom. It's no longer about who should we plate, but when should we plate people. And what is it about? It's about getting people back to their pre-injury condition. It's about putting people back on their golf carts, on the golf course, and everywhere. It's putting people back, doing what they did, getting them back to work. And I think the work that we do and the work that all of you do is quite amazing. And, you know, and we had this talk up here, it was amazing. Don't wait for that ideal case. Get your 3D reconstruction, talk to the patient, show them their ribs. It's amazing if you wheel in the computer and show patients and families their ribs. It's just amazing what they'll do when they look at it and you talk to them. So, you know, as I kind of get to the end here, my journey, it's been absolutely great. And the friendship and the science that you all have given me, amazing, just amazing. But really, watching mentees grow to become confident, competent, and compassionate surgeons, that's where it's at. The true mark of the mentorship lies in the ripple effect. And every one of you, no matter how long you've been doing this, no matter how old you are, is a mentor to somebody. As surgical educators, we gotta do this. We gotta commit ourselves to mentorship. So this is a picture of 5 of my graduating chief residents who are going to graduate in 2 months. I'm graduating 5 women into surgery. Lauren, on the far left, is going to be doing her fellowship at Texas Southwestern Parkland with Linda Dulce. Kendra, between Lauren and I, completed her surgical critical care fellowship in Augusta during her residency and is going to be taking a job as a trauma critical care surgeon in Augusta. Catherine, on the other side, is going to be starting her fellowship in transplant at UCLA. And Sasha is going to be starting her fellowship in minimally invasive surgery in Chicago. Not pictured here is one other resident, Kendra also, and she's going to be doing a breast fellowship at Roswell Park. And this is what it's all about for me. This is what it should be all about for us. We have the ability to pass our skills to somebody else. And, you know, when you have this kind of group, and I mean, this is the whole group, we took pictures last week, we had picture day. I have 41 residents, and it keeps me going. Believe me, it keeps me going. So I really appreciate everything everybody's done for me over my career. And you really don't know how much it means to me to get up here and talk about this. And I really appreciate you giving me the honor of this award. It's absolutely the highlight of my career. So thank you all very much. I know I'm holding you from a good lunch. Enjoy lunch, and I'll be around. Thank you.